Hello everybody! Today, let's talk about the healing process of fracture. The process of fracture healing refers to the process of response and repair of bone tissues and surrounding tissue after fracture. According to the theory of traditional transmission, it is the process of removing blood stasis, produce new blood and bone, healing bones. After modern medical researches, the whole process is like this. First is the hematoma organization period, which generally completes within 2 to 3 weeks after fracture. After fracture, local necrotic tissue causes aseptic inflammation. At the same time, as the fibrin exudates, capillaries begins to proliferate, fibroblasts and phagocytes invade, and hematoma gradually organize to form granulation tissues, and then evolves into fibrous connective tissue, which makes the fracture ends connect together initially, forming fibrous callus. At this time, good alignment of bones must be ensured without repeated stimulation. Some drugs that promote blood circulation and remove blood stasis can also be taken to strengthen the local blood circulation at the fracture end. The second is the primary callus formation stage. Within 24 hours of the fracture, callus grows continuously and fills the medullary cavity of the fracture end, and then gradually forms internal and external calluses. Patients have external callus mostly and less the internal callus. Secondly, there will be endocaudal ossification and the formation of intermediate callus. The third is the callus transformation and shaping stage. It usually takes 2 to 12 weeks to complete when the limbs move and bear load. Callus on the stress axis is continuously strengthened, while that outside the stress axis continuously removed. Osseous connection is achieved at the fracture site. The marrow cavity becomes unobstructed again, and the bone structure returns to normal. During the fracture healing, there are some factors that affect the fracture heal. The first aspect is age. Children have strong tissue regeneration and shaping capabilities, and the fracture is cured more quickly. For example, femoral dysphacial fracture of children only need 1 month, and adults often need about 3 months for healing. The second aspect is heals. Strong body and vigorous qi and blood are beneficial to fracture healing. However, patients with chronic disease and weak qi and blood heal slowly from fracture. Except for the above aspects, local factors are also very important. The first is the contact of section. The larger the contact, the easier it will heal, while the smaller the contact, the harder it will heal. Second is the blood supply at the fracture end. The site with good blood supply heals fast. For example, the fracture at the junction with cancellous bone and metaphysis is the easiest to heal. The delayed healing of the fracture, bone non-union, and even ischemic necrosis of bones will occur at sites with poor blood supply. The third is the degree of damage. The healing will certainly be slow in case of serious injury. The fourth is infection. Infection can cause local long-term congestion, tissue destruction, and metabolic accumulation, affecting the fracture healing. Final is the fixation and exercises. We advise patients to combine exercises and reset treatment in fracture treatment. If the fracture site is overly fixed, it will cause decreased bone metabolism, resulting in osteoporosis and muscle atrophy, which is unfavorable for healing. Therefore, local fracture should be properly fixed. In addition, the upper and lower joints around the fracture should be properly exercised, and the muscular contraction should be properly carried out, which is beneficial to the healing of the fracture. Finally, let's talk about the criteria for fracture healing. Clinically, we divide the standards into two types. The first is the criteria for clinical healing. The criteria for clinical healing is that there are not pressure pain, longitudinal pulsation pain, and abnormal activities. The X-ray film shows that the fracture line is blue, and continuous colors pass through the fracture line. Functional determination is also required to allow the upper limbs to lift 1 kilogram of heavy objects horizontally for 1 minute, and the lower limbs to walk continuously for 3 minutes for at least 30 steps with the external fixation removed. In this case, patients can recover their basic living ability. Another is the criteria for osseous healing of fracture. First, the conditions for clinical healing criteria should be met. Secondly, the X-ray field shows that the bone trabecular passes through fracture line. The fracture site of the patient has completely recovered. In order to meet the criteria of fracture healing, how should we choose treatment? The general principle of treatment is the basic principle of integrated traditional Chinese and Western medicine in the treatment of bone injury. That is, combination of exercises and rest treatment, equal emphasis on bones and muscles, both internal and external treatment, and cooperation between doctors and patients. The first step is to reduce. Reduction is to restore the dislocation fracture end to normal or close to normal state, so as to reconstruct the supporting function of bones. During manipulative reduction, it is required to operate in a timely, safe, accurate, and light manner without aggravating injury, and try to complete it at one time. Clinical reduction has uniform criteria, including anatomic reduction and functional reduction. Anatomic reduction refers to the complete correction of the deformity and dislocation of the fracture, which restores the normal anatomic relationship of the bone. The fracture is anatomically reduced in case of completely good alignment. Another is the functional reduction, which means that although the fracture is reduced for the greatest extent, some dislocation has not been completely corrected. After the fracture heals at the site, however, functions of limb are not significantly heightened. We should try to functional reduce the fracture of patients who can't anatomically reduced. The functional reduction has clear criteria. First is the alignment, which refers to the relationship between two fracture ends on the longitudinal axis. The rotational dislocation of the fracture site must be completely correct as required. The angular dislocation of adults should not exceed 10 degrees, while that of children should not exceed 15 degrees. Otherwise, the future life of patients will be affected. The second is alignment. Aligned site refers to the contact surface between two fracture ends. For the long tubular bone, the aligned site should be at least 1 to 3 or more, while for the fracture of metaphysis, the aligned site should be at least about 3 to 4. The third is length. Children grow and develop more vigorously, and their fractured lower limbs can be shortened within 2 cm, while the fractured lower limbs for adults must not be shortened and dislocated for over 1 cm as required. Otherwise, there will be obviously claudication when walking. The reduction of fracture in traditional Chinese medicine follows the principle of moving child end to mother end of fracture. That is the reduction principle of moving the distal end to proximal end of fracture. We call the distal end the children, and the proximal end the mother. Different methods are adopted according to the site of different fracture. As before, the 8 methods of bone setting and fixation for reduction have been studied in the injury part, so we will not repeat them. Please review the contents. After fracture healing, malunion, delayed healing, or non-union of the fracture may occur for many reasons. Fractures heal after being overlapped, rotated, and angled, which is called malunion of fracture. So, in the process of fracture healing, we must correct the overlapped, rotating, and angular dislocation of fractures. Delayed fracture healing means that after treatment, the healing speed of the fracture is slow, which has exceeded the normal clinical healing time of this kind of fracture. The fracture end has not been connected yet, and the affected part still has pain. Pressing pain, longitudinal percussing pain, and abnormal activities. X-ray field shows that the fracture end produces few calluses, and the fracture line still exists. The fracture end has not been hardened and is accompanied by mild decalcification, but the callus still has the ability to continue to grow. In this case, bone grafting can be considered. Another is that the non-union, which is the fracture still does not heal after required healing time, is extended repeatedly. The healing function of fracture stops, and the fracture end still has abnormal activities. The X-ray film shows that the fracture ends are separated from each other with few calluses. The two fractures ends are atrophied and smooth. The marrow cavity is closed. The bone ends are hardened. It is called non-union. The common treatment is bone grafting. Everyone, we have finished studying the introduction of fracture. So, what are the related knowledge points of dislocation which has many knowledge points in common with fracture? Let's take a look at the next lesson. See you again.